Okay, students, today's class is on urinary system. So, you know that kidney is divided into different parts. Of this, the most important component is the glomeruli, and also you have renal tubules, interstitium, and also the vessels. So, the diseases which affect the glomeruli, you have to learn about glomerulonephritis, and renal tubules and interstitium. You have acute tubular necrosis. These are different pathologies affecting the different compartments of the kidney. Okay, so few common terminologies you will have to understand before this chapter. So that is nephrotic syndrome and nephritic syndrome. So what is this nephrotic and nephritic? Different features are there, like proteinuria more than 3.5 gram, hyperproteinemia, edema, and hyperlipidemia. These are the characteristic features of nephrotic syndrome. Okay, proteinuria, this is excretion of proteins. Hyperproteinemia, that is less amount of proteins in the uh, blood. Edema and hyperlipidemia. There is a nephritic syndrome. You have hematuria, that is blood in urine with a very less amount of proteinuria, and also there will be hypertension. Okay, and these are certain syndromes. This is a common terminologies that we use for different group of diseases or group of symptoms or signs. If we see these four features, then you call it as nephrotic syndrome. And several diseases of kidney present as this nephrotic syndrome. ഓക്കെ, അപ്പോൾ ഒരു ഡിസീസിന് മാത്രമുള്ള ഫീച്ചേഴ്സ് അല്ല ഇത്. ഇപ്പം നെഫ്രോട്ടിക് സിൻഡ്രോമായിട്ട് പ്രസൻറ്റ് ചെയ്യുന്ന പല ഡിസീസസ് ഉണ്ട് കിഡ്നിയിൽ. അതേപോലെ ദർ ആർ ലോട്ട് ഓഫ് ഡിസീസസ് വിച്ച് പ്രസൻസ് വിത്ത് ഫീച്ചേഴ്സ് ഓഫ് നെഫ്രൈറ്റിക് സിൻഡ്രോം. അപ്പോൾ ഇത് ഏതൊക്കെ ഡിസീസസ് ആണ്? ആൻഡ് ദീസ് ആർ ദ ഡിസീസസ് വിച്ച് ആർ വെരി ഇമ്പോർട്ടൻറ്റ് ഇൻ ദ റീനൽ സിസ്റ്റം. ഓക്കെ, സോ these are the diseases which associated with nephrotic syndrome, and that is again classified into primary and secondary. Under primary you have minimal change disease, membranous glomerulonephritis, and focal segmental glomerulosclerosis. These three diseases are very very important. In secondary cases, secondary glomerular diseases, you have diabetic nephropathy and amyloidosis. So these are very important. Now, under primary, you have in nephritic. Okay, these are the diseases associated with nephritic syndrome. Previously, we learned about nephrotic. This is nephritic. So, which are the nephritic syndromes? That is post-infectious glomerulonephritis, or it is also known as diffuse proliferative glomerulonephritis. And the next second one is membranoproliferative glomerulonephritis, IgA nephropathy, and crescentic glomerulonephritis. The secondary causes include henoch-Schönlein purpura, SLE, systemic sclerosis, etc. Okay, so these are the diseases which cause nephritic syndrome, that is presents with hematuria, hypertension, etc. Now, the important glomerulonephritis you have to learn, I will be mentioning today. All these diseases you need not remember, but few diseases you have to remember. One is post-infectious glomerulonephritis or infection-related glomerulonephritis. So that is characterized by, actually this is usually seen in people who are young children, usually after a sore throat or upper respiratory tract infection. That is 1 to 4 weeks after a group A beta hemolytic streptococcal infection. And this can occur after a number of other bacterial, viral, parasitic infections also. What is happening here? There will be anti-streptococcal antibodies. Antibodies are there increased, and also there will be decreased C3 or complement levels. Okay, so this is the characteristic feature. And this anti-streptococcal antibodies, what they do? They will go and bind to different glomerular components, and that results in a glomerular injury. Okay, and that usually this episode will go within 6 weeks, or in few months it will resolve. Okay, so what are the features? Light microscopically you will see diffuse glomerular proliferation. The glomerulus will undergo increased number of cells. Okay, And in just remember these points. You need not remember everything in detail. Immunofluorescence, these are the features. Electron microscopy, these are the features. So granular, IgG, IgM and C3 over the basement membrane and subepithelial deposits. So these features you should remember by heart. So this is the appearance of the glomeruli. Glomeruli is more cellular, with also there will be neutrophils inside the glomeruli because it is infection. Now the second important glomerulonephritis is known as crescentic glomerulonephritis or rapidly progressive glomerulonephritis. Again, it is divided into three types: type 1, type 2 and type 3. Type 1 is also known as anti-GBM antibody type. That is due to deposition, linear deposition of IgG, which is an immunoglobulin which is deposited in the glomeruli. So that is related to certain diseases like good pasture syndrome. Type 2 is known as immune complex related. It is also seen in different diseases like SLE, HSP, IgA nephropathy, etc. Type 3 is a passive immune type, and that is seen in vaginous granulomatosis and PAN. So these are the classification of crescentic. This also you should remember this type 1, type 2 and type 3. Now another important type of nephritis is known as pyelonephritis. What is this pyelonephritis? That is nothing but the inflammation or infection of the kidney. Kidney in total. That is the glomeruli, the tubules or the renal parenchyma as such. Okay, the complete renal parenchyma. And that is how kidney is infected. It can get infection from the blood. That is a hematogenous route or the retrograde spread. How is the retrograde spread? That is from the ureter upwards it can spread. It can be either because of a complicated UTI also. UTI, if it is kept like that, what happens? It will complicate. It will after several days or several months, if it is going like that, that will affect. It will go upgrade. It will go in the upstream pathway, and that will affect the kidney also. Okay, and so this is how it goes. Ascending infection, the common agents include E. coli because that is the common agent which causes UTI also. Then Proteus enterobacter, also it can come through the blood from other parts of the body, that is hematogenous routes. Staphylococci, that is the common cause. Now another important thing which you have to learn in kidney is renal cell carcinoma, which is also known as Gravit's tumor or hypernephroma, and it's usually seen in about 60 to 70 years of age. Okay, patient presents with hematuria, also loin pain or abdominal pain or mass. And the lot of paraneoplastic syndromes which are associated, that is the patient will present with lot of other features like hypercalcemia, hypertension, polycythemia, hepatic dysfunction, then Cushing syndrome, okay, eosinophilia, etc. So these are certain conditions which can be seen associated with this renal cell carcinoma. Okay, and that is usually seen associated with some tobacco smoking, obesity, hypertension, etc. And also there can be hereditary association also, which is associated with VHL gene. VHL, that is von Hippel-Lindau gene. Okay, so that is another genetic association, and even it can be seen in a younger age group also. If the patient is having this genetic defect, this renal cell carcinoma is usually seen in younger age group also, and that is an adenocarcinoma. So in renal cell carcinoma, the histological feature that it is an adenocarcinoma. Okay, and grossly usually it is seen in the upper part of the, this is very important. RCC, if they ask you, you have to mention all the gross features, microscopic features. It is very important. So it is usually seen in the upper part of the kidney, and it is having a lot of areas of hemorrhage, necrosis. Okay, and it can even reach the renal veins. Through the renal vein it can enter the inferior vena cava, and it can reach the right atrium of the heart. So like that it can spread to different areas of the body, okay, through this venous connection. In the communication between the renal vein and the right atria, it can spread to different parts of the body. Okay, so that is hematogenous spread. Histological variants are also very important. The important one you have to remember is a clear cell renal cell carcinoma. That is very, very important. That is the most common subtype. Clear cell renal cell carcinoma. Also, the other rarer variants are papillary, chromophore, and collecting duct. So this is a picture, microscopic picture. It's very important. You have to draw this diagram if they ask renal cell carcinoma, because you have clear cells. The cells are having clear cytoplasm with a central nucleus, okay, and very definite cell borders. The cell membrane is very clear here, okay. So that is, and these cells are surrounded by small blood vessels, okay. So that is nothing but a clear cell carcinoma microscopic, which you have to draw this diagram. They are arranged as small nests with very clear, abundant clear cytoplasm with well defined cell membranes and the central nucleus, okay. And it has a tendency to metastasize. It can metastasize to lungs, bones, etc. Now, another important tumor which you see in childhood in children is Wilms tumor. So, that is also a renal tumor which you see in childhood less than 10 years. And again, the presentation, common presentation is abdominal mass, abdominal pain, hematuria, hypertension, etc. Okay, now the other important tumor in urinary bladder is a transitional cell carcinoma and the squamous cell carcinoma. These are the two important. So you should remember what all tumors you get in different parts. In kidney you have RCC and Wilms tumor in children. In urinary bladder you have transitional cell carcinoma as well as a squamous cell carcinoma. Okay, so just remember the names. Now, renal calculi, this is very important for you. Renal calculi, or you also known as urolithiasis, it is asked as a short note for you people. So, urolithiasis is most common in kidney with a familial and hereditary predisposition, and some metabolical disorders like gout, which is a uric acid elevated condition, cystinuria, hyperoxaluria, all these conditions you get these stones in the kidney. So what there are four main types of renal stones. So what are those four types? First one is calcium stones. Calcium stones are the most common variant, that is 70% of the renal stones are made up of calcium. Okay, so that is the most common variant in calcium stone is calcium oxalate stones, or it can be calcium oxalate plus calcium phosphate stones. The second type is the triple stone or the struvite stone, which constitutes 15% of the total renal stones. And this triple stone is made up of magnesium ammonium phosphate. That's why it is known as triple. Magnesium ammonium phosphate. Okay. The third one is uric acid stone, which constitutes 5 to 10% of the all renal stones. The fourth one is the cystine stones. So these are the four types of renal stones or urolithiasis. The first is about calcium oxalate stone. So calcium oxalate stone is usually single and is very hard. Okay. They have spikes with sharp projections, and what happens with this sharp projections? This sharp projection can cause bleeding. Okay, so the patient will present with blood in the urine with because this sharp projections will go and break the urinary bladder, or it can even break the ureters. When it passes through this ureters, it will break the mucosa, and that will cause bleeding because of this spikes, okay, projections. It is very dark in color. It is radio opaque, so you can even see through the x-ray. Second one is triple phosphate stones or struvite stones. Okay, this is the etiology is very important hereby because it is seen in patients with the UTI, which is caused by urea splitting organisms like protease. Okay, or Klebsiella, etc. So that is also known as infection-induced stones. And what is the important feature of this triple stone? It is also known as a staghorn stone. Why? Because it is very big in size, and that big size will the urinary stones will actually be, we can see it is following that urinary the calyces, the renal calyces. You can see this filling the calyces, the filling the whole kidney like very big stones. Okay, like a stag horn, like a horn. Okay, അത്രയും വലിയ ഹോൺസ് പോലെ അത് it will be filling that urinary the renal pelvis and renal calyces. So that is causing severe obstruction also. That is staghorn or triple stones. എല്ലാത്തിനും അതും എല്ലാം ഒന്നാണ്, triple stone or staghorn. Now the other one is uric acid stone. What is the importance? It is radiolucent, and the importance is again it is associated with hyperuricemia or gout, and also in case of myeloproliferative disorders, any leukemias, etc. Because the cell turnover is very high, so uric acid production is also very high. So that's why it is usually seen in gout and myeloproliferative disorders. Okay. Now uric acid stones, again it is multiple, and it is moderately hard with yellow to brown color. Cystine stones are caused by again some genetic defects. It's very rare. It is usually seen in cystinuria. Okay, and okay, so it is usually seen in this amino acid disorder, that is cystinuria, and excessive secretion of this cystine. Why? Because it is the least soluble of all amino acids. So it is least soluble, so it tends to form stones. Okay, so that completes your renal system. Okay, urinary system is over. So almost all the portions are over for you people. For the next class, I will be uploading a PowerPoint on thyroid. Thyroid, I think you might have learned in your physiology classes, so I won't be taking a recorded video for you people. You have to just go through this that thyroid PowerPoint, and important points I will important questions I will be telling you. You can write down the whole PowerPoint. And also I know that some PowerPoints is not recorded as a video, like respiratory system I gave it as a PowerPoint. Anyway, classes won't be taken. You have to read that respiratory system class as well as the thyroid class, because questions, very few questions were asked in from the thyroid, but respiratory system few questions like pneumoconiosis were asked. So I will just uploading the thyroid class, and also the respiratory system class I have already uploaded. So you have to learn all these things. Now almost the portions for you people are over. Let me see if any other topics are left behind. Other than that, almost all the topics are over for you. So with the thyroid class or thyroid PowerPoint, everything will be over. Okay, so you can start your revision classes. Your revision you can learn. Okay, if you want any assistance from my side, you can always ask. Okay, thank you.